So there's a lot of definitions of ethical AI. The one that I have is an artificial intelligence, whether it's a virtual machine, an agent, a chatbot, or a robotic system that has an embodiment. It's having the system do things that minimize harm, but maximize good. Right? If you think about it, we as people, we always have to balance in the gray. Right? There's things that we want to do that are positive, but maybe someone might get harmed. So how do we balance this? And we make these decisions all the time, from, deciding to give, my one cookie, who do I give it to? Which child? Do I split it? Like, we make these decisions all the time. That's really the aspects of ethical AI, is how do you give AI the ability and the tool to make these decisions that are hard. They're not black and white. Someone might lose, but hopefully you're making someone else have an immense amount of gain. So think about ethics in general. It varies based on culture. It varies based on country. It varies based on even your family within the same culture, within the same country, right? And so how do you define the rules of ethics? It's really, really hard. It's really, really difficult. And so one of the ways that you can create ethical AI is basically looking at all the rules that people have all over. So if you think about the diversity, geographical location, economics, gender, ethnicity, and you put it in and you figure out what is that superset that everyone can agree. We kind of all agree, for example, that, we probably shouldn't kill anyone except unless we're in danger, right? So we can probably all agree to that. So if we're designing an AI system and say it's a system that's a medical doctor, right? Then it should be operating based on, okay, I, with all my ability, should be saving this person's life, right? Like that then is this aspect of ethics. And so I think that's how we do. And so in my group, we try to figure out what that superset is by bringing diverse people together to really come up with rules that the AI system can learn. So humans don't intuitively have a gut feeling for ethics. They're trained on it. So think about when you're a little child. We teach kids not to steal, right? Because what happens is they come into the kitchen and they take the cookie or the candy that they weren't supposed to, right? Because, hey, there's a piece of candy. No one's looking. I'm going to take it. And someone comes in and says, who took my candy? Right? And you basically then reprimand them. That's not right. So we teach kids these ethics. Kids don't come out like knowing that things are right or wrong. They're taught. I think that's the same thing with AI. It has to be taught. People are not ethical by the age of 1. They grow to be ethically conscious. So the upsides, if we get this aspect of ethical AI right, is that our quality of life will be amazing and immense. It means that things like education, which will be much more accessible to everyone. It means healthcare. We'll have personalized healthcare where you might come to a doctor and someone else come to the doctor and we get exactly the same outcomes, which basically means we live forever or as long as we can. I have 2 patients come in. I have a limited amount of resources. Who do I say first? Traditionally, doctors, they have a code of conduct. They usually look at things like who has the highest rate of survivability, who has the worst issues in terms of ailments, right? So they make this judgment call because they act in an ethical frame of mind. So instead, think of an AI that's not ethical. 2 people come in. All right, what should I do? Well, this person has a lot more money and can pay the hospital bill. I think I'm going to save that person, right? Like, what's to say that's wrong? What's to say that's right? Right? Because you can only work on one. You can only operate on one. I truly believe there's 2 areas where ethical AI can have the most value. One is in personalized healthcare. If we look at the number of individuals that are growing older, that are, we'd like them to stay in their homes and live happy lives. We can't do that unless we have the resources. And this is robotics and AI that provides some services in the home, right? So I think we have the most benefit there. And the other is on the other extreme. So that's, say, older adults as we get older. The other extreme is with kids and education. If you think about the way that jobs are forming, the workforce and the types of jobs are changing every day. And in 10 years are going to be different than the ones we have now. In 20 years, who knows, right? If you think about what kind of scaffolds, what kind of tutoring, what kind of personalized learning can we provide in the home, in the school, to offset the lack of teachers in some places, like that's the other domain that I think we can have the most benefit, because that then leads to ensuring that everyone has the ability to buy a house, feed their kids, and all these things that we think of as a fundamental human right. So if we don't get this right, the gap between the people who have and the people who have not is going to get wider. When I always say that means that, people like myself who design and develop, I'll be okay and my kids will be okay. But the people who are not as knowledgeable will not, which is basically a lot of individuals in this world. And so if we don't get it right, we will have a very small population of people who benefit, and then everyone else will not. And I think about some of the movies that are out that show this, right? If you think about movies such as The Matrix, there was a very small population that believed, right? Which pill will you take, right? Very small population that believed. And if you look at their lifestyle, they were happy, but basically poor. And then the rest of society, they had jobs and they were in this virtual, but in reality, they were in cocoons, right? That's the reality if we are not careful.